I'm Dr. Adilakshmi, Infectious Disease Consultant in KIMS Health. September 28th is observed as World Rabies Day. This is to increase awareness about rabies prevention in humans. So, world over, around 60,000 cases of rabies are reported in humans, and majority of the cases occur in Africa and Asia. So, it's important that we analyze and then take preventive measures to bring down the number of human rabies. This year's WHO's theme is One Health, Zero Death. That is, by 2030, to bring the human rabies infection to the minimum. That is called elimination of human rabies. So, to understand this One Health system is important. We all know that we and animals, humans and animals, live in one environment. So, unless we bring down the number of cases of rabies in dogs, which is the commonest cause of human rabies elimination will be difficult. So 99% of human rabies are caused by animal bites, and animal bites means 99% it is due to dog bites, and less commonly it is due to other animals, including some of the wild animals and cats. So it is important to bring down dog rabies to eliminate human rabies. So we have to look at two aspects. One is how to bring down dog rabies. We all have some role to play, especially if you have pet dogs, to vaccinate appropriately and annually if it is required, and then take care of your pets. Don't provoke animals, especially this has to be educated to the children, because among the human rabies, children are most vulnerable. It is also important to reduce the dog population or take care of the dog population by appropriate animal birth control measures, and also we have to think about appropriate food waste disposal to reduce formation of dog packs because they all eat together. Coming to how to prevent human rabies, there are excellent preventive measures which, if taken appropriately and at the correct time, human rabies can be completely preventable. The most important thing that we talk about is the wound care, which many people take it lightly. So the wound care is very important. 10 to 15 minutes of thorough soap and water wash, and if possible you can use a betadine solution, that is called antivirucidal solution, that can be also applied to thoroughly wash and get rid of the virus as much as possible from the wound. And based on the category, we determine or advise whether the patient needs vaccines or just the wound care or additionally immunoglobulin. This is decided by the clinician. So we categorize the wound as category 1, 2 and 3, and in 1 there won't be any wound noted, it is only licks and the skin will be intact, where, as I said, a thorough wound care or wash or skin wash will be sufficient. If there is a mild skin peeling called the abrasion and then some bleeding, then definitely you will need vaccine. And if it is a deeper wound or multiple wound, in addition to vaccine, you may need immunoglobulin. So this is determined by the doctor, and as per their advice, a follow-up is needed to complete the whole protocol. And we can also, in select groups, advise pre-exposure prophylaxis. That means even before you get a dog bite or a scratch, for some high-risk population, preventive vaccines are advised, and these are usually veterinarians and some lab technicians who are exposed to these viruses, and in rare and some cases where a foreigner or any person who visits a place where a rabies is very endemic or more cases are reported. And these are the preventive measures, but to assure that by taking proper wound care and appropriate vaccines and immunoglobulins, human rabies can be prevented. Even though there are some concerns about getting rabies even after vaccination in the recent report, that should not deter or raise queries about vaccine efficacy, because rabies is definitely vaccine preventable disease. So if appropriate vaccine is taken on the right time, the right dose, human rabies vaccine is excellent in preventing rabies.
Ethnic Health Code in public interest.